Mark mentioned the building being an incubator. We're able to have new projects up here. The one thing that this building was built for is health services. And here to talk about health services is the Pima County Health Director, Sherry Daniels.
Thank you. As far as incubators go, I hope we're not incubating anything with it. My staff has been talking about this building for some time, and I've been looking at the plans for this building for several years, and it didn't do it any justice. I mean, it is a beautiful building. My staff is thrilled. As you know, Pat Wallace is the public health nurse that lives and breathes Catalina as your public health nurse in this area. When I was at our North office yesterday, talking with staff and looking at our facility there, half a dozen of them approached me and said, "Can you move to the Catalina building? It's so beautiful." So you've done yourselves proud with this project. We're thrilled to be able to provide health services in a standing spot as opposed to a mobile clinic that kind of drives around and is in different places. I was a public health nurse for the health department in the 70s. I was a baby, of course. And at the time, we used to do some very limited things up here. And if my recollection is correct, sometimes those are even immunizations out of the back of a station wagon. And so we are beyond thrilled that we have a beautiful clinical space, the ability to provide some services here on a routine basis that we've never been able to do. That staff will be available on different days so people can come in and talk to Pat Wallace and talk to the other clinical service folks who may be here. We'll be able to provide immunizations on a regular basis here. We'll be able to do skin tests for TB on a regular basis here. And we'll also be able to do family planning or what we call sexual health. Doesn't sound quite right when I say it that way, but reproductive health clinics here on a routine basis as well. So as the director of the health department, I also want to thank those who were visionary enough and who persevered, it sounds like quite a bit, in finding money and more money and then some more money in making this happen. And the health department is very pleased to be a partnership with this and to incubate whatever comes next.